Can superspreaders cause large TB outbreaks? Can superspreaders cause large tuberculosis outbreaks? The answer is yes. Superspreaders are individuals who infect significantly more people than the average person with tuberculosis. In fact, a small number of TB patients are responsible for a large majority of new infections during outbreaks. This phenomenon is crucial to understanding how tuberculosis spreads. Tuberculosis transmission is not uniform. Some patients, particularly those with active pulmonary tuberculosis confirmed by laboratory tests, are much more infectious. Research indicates that around 10% of TB patients can be classified as superspreaders. These individuals account for over 75% of secondary tuberculosis infections. This highlights the importance of superspreading in the epidemiology of tuberculosis. Several factors contribute to why some TB patients become superspreaders. They may have higher bacterial loads, which means they carry more of the bacteria that causes tuberculosis. Additionally, they often have more severe lung disease, such as cavitary tuberculosis, which increases the risk of spreading the bacteria. Certain behaviors and conditions also elevate the risk of transmission. For example, prolonged close contact with others, or co-infections that lead to increased pathogen shedding, can make a person more likely to spread TB. The environment plays a significant role as well. Poor ventilation and crowded settings can facilitate the airborne spread of Mycobacterium tuberculosis, the bacteria responsible for tuberculosis. These conditions can create an ideal situation for superspreading events to occur. Understanding the role of superspreaders is vital for effective tuberculosis control strategies. By identifying and treating highly infectious individuals quickly, public health efforts can significantly reduce the risk of large outbreaks. This includes ensuring rapid diagnosis, effective treatment, and implementing infection control measures in both healthcare and community settings. From the perspective of tuberculosis as a disease, it is important to note that only active tuberculosis patients can cause outbreaks. Active tuberculosis is when the bacteria are multiplying and can be transmitted through the air. In contrast, latent tuberculosis infection, where the bacteria are dormant, does not contribute to transmission. In summary, superspreaders are a key factor in driving large tuberculosis outbreaks due to their high level of infectiousness. Addressing this issue is essential for effective tuberculosis control and prevention. If you have concerns about tuberculosis, it is always best to consult with a healthcare professional for personalized advice and information.